cobbling together their child care scheme, frequently relying on family and friends to fill their gaps. Affordability for them often meant compromise. So parents often had to find themselves choosing between options that were must-have versus nice-to-have. And a lot of times they ended up trading costs for situations that would accommodate their work schedule. Another thing that they talked about was building provider and parent trust. They noted that the routines and good communication that they had with their provider was really important, particularly with the Latino families and these families that had children with special needs. They were really concerned they were really concerned that they had good relationships with their providers, and even though some of them still expressed great doubt and mistrust for their child care providers in general. Like I said, it was particularly important for Latino parents and parents with special needs kids. They talked about quality care being multifaceted. Parents agreed that quality care meant a lot of the same things that we talk about: clean, safe, loving environments, having a day that was filled with structure, routine, having learning that was developmentally appropriate, having play. But they also talked about looking to their children for reactions as a cue for quality. They wanted to observe how their child reacted to staff and other children. So if they felt their children were happy and feeling comfortable with their caregivers, that to them was a component of quality. And finally, the search for child care was difficult and frustrating. They talked about that it could take anywhere from a few weeks to months to find or determine their child care situation. And many didn't know where to start, even though they started early. A lot of times with when they found out they were pregnant, they just didn't know where to go. And they weren't aware of county-based or city-based listings or government offices or CCRNRs that could provide assistance in helping them find child care. And none of them actually mentioned specific CCRNRs. But we did find that they relied heavily on the internet and places like Facebook and Craigslist, and realized, though, that they weren't necessarily effective or reliable sources for locating child care providers. So I think there's some room for marketing, and they're really looking for understanding how they can find quality care. So if we can turn to the next page. So in addition to doing the focus groups, we held in-depth interviews with several statewide offices and organizations, as well as one regional referral office. We asked them to describe their motivations for setting child care supply and demand. We wanted to know how they collected the data and reported it, what impact they saw from their reporting, what lessons they would pass on to others setting supply and demand. And we also came across a few states that we weren't able to do in-depth interviews with, but were able to have snippets throughout the paper on. So the in-depth interviews that we did were with Kansas, Vermont, Maryland, Ohio, Florida, and the Triangle region in North Carolina. And then we were able to do some scans and some brief conversations with folks in Delaware, New York, and Philadelphia. And I'm not going to take you through each state just because we don't have a lot of time, and I encourage you to read through some of those stories. They're very interesting, and each had their own concerns or lessons. But what I want to do, though, is share some overarching themes and lessons learned. For instance, one of the things that we heard a lot was the importance of tailoring your study of supply and demand to your audience. So, for instance, it's really important to present data so that it's easy to understand and use by your target audience. So, for example, in Vermont, they had a racing theme for their report that was called Stalled at the Start. And when they highlighted information for the different counties, they had different colored racing flags, red, green, and checkered flags to demonstrate where the states were. And although sometimes the themes might seem cheesy, but they're things that are easily presented to others who might not understand research and are easily understood. Other places like Maryland had beautiful charts and figures that they showed for each of the county, and in North Carolina they included infographics. So really having seen their data visualization, and thinking about who you're trying to share your data with was really important. Data collection is also expensive, so some of the folks talked about only making sure that they collect data that had a purpose and relevancy for the work that they were doing. So in Vermont, for instance, they used stakeholder groups to help them decide what kind of data they were going to collect and how they were going to go about getting that data. And some communities looked at data at the community and neighborhood level. They felt that those communities and neighborhoods had very unique needs. One of the things that we heard from a lot of different, we keep calling them communities because each of those places that we talked about making sure that you define community for yourself and quality for yourself, for your state, and figure out what makes most sense for your state. And so there's a little bit of that information in Kansas and in Indiana. Another important thing they talked about was making sure that you maintain quality and consistent data. And I really see this as a possible place for CCRNRs and other PA providers to make sure that states understand or entities understand the best way to gather data that's quality and consistent. Some of the lessons learned we heard from states that said make sure that you pull the same data at the same time of the year, that you train people if you're working with different data sets to understand what you're looking to get from them, what data they want to pull, and making sure that if you can, having someone who has been trained on your team that's familiar with the data, that understands how it's cleaned and the needs that you have for using the data. And if you don't have the same consistent staff to do that, make sure that it's written down somewhere so that there's manuals, code books, and guidebooks. Another thing that they talked about is collaborating whenever you can. So as I mentioned in Vermont, they had a working group of key stakeholders. In Florida, they worked with other organizations across the state to build a comprehensive data set. And they used APIs or computer applications so that the different data sets could talk to one another and be updated regularly. And then in Maryland, they had an interorganizational communication so that everybody who was interested in the data understood what data was being collected and how it could be used. Of course, it's important to not reinvent the wheel, learn from others. A lot of states talked about making sure they reached out to others who were doing this work. And one of the things I think that will be helpful with this report is you can look at the examples in our report, look at the context that we've provided, and maybe there's some examples that you can use or you can think about, look out for some thought partners to help you think about how you can measure supply and demand in your community. And then finally, leverage other resources. Be creative when you're managing your resources. Some communities said they had funding to conduct these supply and demand studies, but as I mentioned, it's pretty expensive, and some didn't have funding. So they looked at how they could leverage other resources from others in their community. So for instance, they may look at the use of graduate student interns to help them collect and analyze data. Another place in Delaware, when they were looking for solutions for gaps in care, they ended up partnering the Delaware Community College and the National Guard and Reserve Drill Weekend Child Care Facility partnered to make sure that students in early childhood education that needed service learning hours could get those hours. They covered their care during those non-traditional hours. And the center needed labor and help during those non-traditional hours. So it was a win-win for both groups. And they came up with a partnership that worked. So those are just some of the lessons that we've learned, and as you read the report, you'll be able to see some others. I'm going to turn over the mic now to Angie Saenger, who is from CCAoA of Kansas. She's going to share with us a little bit about what they did in Kansas and where they plan to take this work in the future. So I'll turn it over to her.
Hi, Dionne. Can you hear me?
I can hear you.
Can you hear me?
Thank you.
Well, thank you for the opportunity to share just a little bit about our experience with child care supply demand here in Kansas. I thought I would talk just a little bit about what we are doing as we move forward, highlight a lesson learned, and talk about what our immediate plans include. So in the past, we've taken data, the data route really, producing reports, using our internal database. We've compared numbers of child care referrals from our child care referral center to numbers of facilities in the county, and that allowed us to rank counties in Kansas that show a high need of care. However, over the last several years, we feel like that information only tells part of the story. So we'll still pull that information and other data from our database and use it for discussions and planning, but we are also looking more broadly at data and reports and stories all around the topic of supply-demand. I think our experience working in communities has helped us to think about where we want to go. So some of the information, you've talked about kind of the community level, some of the information that we've included and shared with communities has been around types and number of facilities in a specific area, whether it's a community or in a county, licensed capacity of child care providers, and information about what it takes to operate a child care facility, just to highlight a few of the data points. Sometimes in the communities we're part of a meeting to discuss child care needs of families and others. And other times we've just been able to provide data to help support their discussions. It just really depends on what their needs are. As you know, communities really are at different places when they're thinking about child care issues, and their need for support just varies. So we try to meet their needs wherever they're at. So I thought maybe to help think about the community issues and conversations, that we could just highlight a couple of examples that we've been able to, of some information we've been able to share in communities at the community level. We had a mayor and some community level leaders who were concerned about a child care center closing in their area and what that would mean for parents. So some of our staff were able to attend a meeting to help them research options to meet their needs and to move forward. And then in another example, a major employer in a small community was having trouble filling job openings because the candidates that they were wanting to offer jobs to were having a hard time finding childcare that met their needs, whether it was non-traditional hours or infant care. So this group was wanting to increase slots in their community. So we were able to share with them about the different types of child care facilities. So they were really at the beginning stages of their investigation. So, speaking more specifically to lessons learned, as we have been sharing stories about community needs, we see an opportunity internally for developing a system for capturing I would say the anecdotal information about the activities that are happening at the local level. A lot of times these conversations and these requests come directly to the CCRNRs. So we think these stories are part of the bigger picture of supply-demand. So if we get a request for data, or if we're asked to be part of a meeting, or a community leader reaches out with questions, we want to be able to document all of those requests and conversations to help paint the picture about what is happening here in Kansas around child care supply-demand. We've also been researching and exploring what other states are doing as far as reporting and the data that they've used to help tell the stories. So this webinar is interesting and helpful, as well as the new paper released from Child Care of America. We think that all of the exploration that we're doing will help us save time, and we'll be able to also see what other data sources other states are using. I would just say our immediate plans, we are focused on creating a template for a new annual report that we'll be completing in partnership with our CCDF State Plan Administrator, which is the Kansas Department for Children and Families. And as we move forward, we'll be looking more broadly at supply-demand. We will still focus on data and generating reports, but we want to make sure that we are supporting our CCRNRs too, who are working to update vacancies and profiles, so that the child care referrals are processed with the most accurate information for families who are searching for care. And we also hope to work with Child Care of America on the mapping opportunity, which you mentioned a little bit earlier. And we're excited to continue conversations and research and to keep learning about child care supply-demand. So thank you for the opportunity to share just a little bit about what is happening here in Kansas.
Thank you so much for that information. And you know, we talked to a lot of people about their stories, and we're very excited when Angie and her team agreed to be part of this call. Next, I'm going to turn the mic over to Jen Bump, who is our Senior Director of Practice and Innovation, and she's going to share some really cool mapping examples that we're working here at CCAoA, and talk about how we as a national organization are thinking about this work at the state and local level and where we might be able to help states do this work. So if we cut to the next slide. Oh. Jen, can you hear us?
I sure can. Dionne, can you hear me?
Yes, we can hear you. Go ahead.
Great. Well, thank you so much to everybody for the opportunity. Angie, thanks so much for your contribution as well. It's very exciting to see what you're doing in Kansas. It's a great example, I think, for CCR&Rs and others around the country. I have a couple of examples to show today on the screen. One is an example from my work at the Indiana Association for Child Care Resource and Referral. The map that I'll show is also is the map that is referred to in the Child Care Deserts report. The additional map that we're going to show today is really a proof of concept with New Hampshire. Both examples leverage data from NDS, that's the National Data System for Child Care. It's a child care supply, demand, cost, and quality data system that is used in close to 40 states around the nation. And here's some specific statistics about that data system. Dionne, I'm ready for the next slide. Great, okay. So the map that you'll see here, again, this is the map, one of the many, many maps that were used in Indiana and that are highlighted in the Indiana Profile in the Deserts report. What you'll see is a display of child care facility data from NDS with an overlay of concentration of CCDF voucher recipients on this dynamic heat map. So you'll see the colors from a spectrum from green to yellow to orange to red. Where you see the red areas, that is where there are concentrations of children who have CCDF vouchers. You'll also see pins on that map in different colors. That represents the different levels of quality in the QRIS system, past the quality in Indiana. And you can tell that this really can be valuable when it comes to really understanding where there's the greatest need for high-quality child care deserts. And you'll see on the top right-hand side of that screen a really good example of a child care desert where we've got a large red spot and we've got no pins. That information can quickly inform the work of both child care resource and referral agencies, of state CCDF administrators, and of course stakeholders and others with interest in this issue. I'll note, as Dionne said, this type of map is only possible through partnership. And this partnership was between the Indiana Child Care Resource and Referral System, as well as the Indiana state government and the CCDF administrator. Next slide. Okay, so you know, I've worked at the local, state, national level throughout my career in child care resource and referral. I've had the pleasure to learn from many a great mentor, folks who have been doing this work for many years. Child care resource and referral has been around since the 60s, and this is not a new effort. The place the thing that makes this different is our ability to leverage technology, our ability to leverage partnerships, new partnerships. And so coming back to Child Care Aware of America after many years in Indiana, we had the opportunity not only to partner with the policy and research team at Child Care Aware of America, but to partner with the state. And in particular, we reached out to the state of New Hampshire, and they are a state who's done a lot of great work with their data systems over the past several years. And we invited them to be a part of this proof of concept. And the idea was to bring some of the work that had been done in Indiana to other states, and eventually we're looking to create a nationwide solution for child care supply and demand mapping. Again, this example is built off of the NDS data system. It's a product of Child Care of America. It's a direct connection to that data and an overlay with demand data that comes from census. Before I show the maps, I want to, of course, thank the partners at New Hampshire, the New Hampshire CCDF State Administrator's Office, Kristen Booth and Claudette Mallory so much. They couldn't be with us here today, but again, the work that you're about to see wouldn't be possible without their willingness to experiment with us. I also want to thank Tracy Pond at Child Care of New Hampshire for her work. She also wasn't able to be with us, and then of course, thanks to the NDS team for their contributions. Next slide, Dionne. Okay, so what you'll see on the right-hand side of the screen is just a straight screenshot, and it's intended to give you a sense of the tool that we're developing. This is a live tool, a live map that pulls in licensed child care programs from the NDS data system that's used by the state of New Hampshire. It maps a couple of different pieces of information. First thing it maps is child care facilities, and it maps those by quality level. So we have three different quality levels. Basic is licensed, licensed plus, and then the highest quality is accredited. So you'll see those in the pins, and then you'll see different colors. And those colors represent the difference between the number of, this is census data, all children 0 to 5, with all parents in the labor force by zip code. And so the differences in colors from yellow to green to orange to red, just like on the Indiana heat map, represent the areas where there's the greatest difference between the number of children who need care and the number of licensed slots in that particular zip code. Next slide, Dionne. Great. So I just wanted to give you a picture of how this map works when it's live. So just like any other Google map on your phone or on your computer, you can zoom in, you can zoom out, and it allows you to really get a different level of information from the neighborhood level. So on the left, you see what we saw on the last screen. This is the statewide view. But what you see on the right is really a zoomed-in zip code level view of an area in New Hampshire. I believe this is close to Concord, where there is one of the highest, the areas with the highest difference between children who need care and the number of slots available. Next slide. Again, we were unable to have our partners in New Hampshire join us, but they wanted to share some language with the rest of you, some information about how this work has been of value to them initially, and how they see this work being valuable in terms of really identifying where the investment will have the greatest impact in regard to access to quality, affordable child care for families. The next step on the next screen, Dionne, is to expand our mapping to include filtering by age group. So, for example, the map that you just saw looked at licensed child care slots for any age group. As we work with states to implement CCDBG and their state plans, we know that there are specific age group focuses, for example, focusing on infant toddler care. So we'll work closely with Child Care of New Hampshire Kristen Booth and Claudette in New Hampshire State Administrator's Office to pull that data and to create a visual representation of where the greatest need is. Next, we were very excited that we're going to dig deeper in terms of the use of, or the demand based on CCDF usage by zip code. The map that you see currently is, it's demand as defined by census data, children 0 to 5, or all parents in the labor force. And then finally, we're very excited about the next step. We look to expand our mapping capability with NDS and NDS partners in the states listed there. All are in geographically diverse areas throughout the nation, and we look forward to really including their feedback on what can be of most value in their state.
Jen, thank you so much. I really appreciate the work you're doing. We see so much possibility. As you mentioned, we're going to be doing some deep dives in some specific states. And, you know, reach out to Jen if you have some questions about how her systems can be used to help you map out child care deserts. We did reach our parent. And so we're going to see if we can have her tell her story really quickly. She's on a cell phone, and we're going to see if we can have her share her story really quickly. This is Mari. Hi, Mari.
Hi, does everyone hear me?
I think they can hear you, yes. Can you just quickly tell us about your story and maybe thinking about what your plans will be in the future given your struggle with child care?
Yes, so I gave birth to a beautiful baby over 6 months ago, and I went on, you know, parental leave, maternity leave. And I'm in California, so here you go on SDI disability, short-term disability work. So I've been on that, and then when it's time for me to go back, because in California you only have job protection for up to 6 months, so I took a full 6 months, and my job even actually threw in an extra month. When it was time to go back, I was not able to find affordable, adequate child care. Based on, I would say, about there's 3 things where this happened. So in California, specifically San Francisco and the Bay Area, it's very, very expensive to live here, and so that makes not only housing expensive, but everything expensive. So, for example, the neighborhood that I live in, you know, some of the people live in neighborhoods like Mark Zuckerberg, a lot of techie people, and so the amount that they can pay for childcare is very different than working class or even middle class people. So one thing is that childcare is very, very expensive in San Francisco, even though the childcare workers don't get paid as well. So that is one point to put out. So what's kind of required in San Francisco is to get a childcare subsidy. So one thing is I've been on a different childcare subsidy list ever since my 2nd trimester of pregnancy, and still have not been picked to be on the list. There are currently over 3,500 families in San Francisco waiting to be called in one of the child care centers in San Francisco that are actually affordable with the subsidy. So I'm one of those 3,500 families. The second thing is, you know, looking at other forms of child care, right, like doing nanny share or paying someone you know. The rate of to pay someone in San Francisco, most people, the cheapest I've seen is about $20 an hour. So that person will probably be making more, or if not, you know, maybe it's a little bit less than me. So I'm not able to pay for an out-of-pocket nanny by myself. And then also, just to point out, I think another group, I know you guys are talking about different groups, is that I was single parent. So I'm a single parent and a single mom. Right? And so a lot of single moms don't have that dual income. So, you know, sometimes I meet couples and they say, oh yeah, my check all goes to child care and their check goes to the resident. So it sounds like nowadays, especially in the San Bay area, maybe even across nationally, you have to have a two-parent income to pay for child care. So then what happens when you don't have two parents in the house, when you have single, or two working parents, I would say. So maybe the family is a grandma and a mom. So what does that family look like? So I think it's good to think about families that are not non-traditional families, right? Where they're more than, it's not just two parents, maybe, only a single parent or single parent with an older relative or this or this. And then I think there's a third group that I don't maybe apply to as much, but in California there's a mandatory vaccination. And I know you guys pointed out that that would be another child care desert as well. But I know a lot of parents who now are struggling to figure out how to pay for child care but not put their kids in a child care center because of mandatory vaccination and everything, because their religious beliefs don't align with vaccinating a child. So for me, what I ended up doing is I resigned. I really didn't have much of a choice. I've been on all the waiting lists, gone into different child care centers, in-person home care centers, talked to people, figured out, tried out my budget, but it didn't work out. So currently I'll just be unemployed. My next option, what I'll probably be doing is applying for CalWorks, which is cash aid and GA. And because it sounds really sad, but to get $600 or $700 a month is actually more money than if I was working and paid for child care, for $100 a month. And then I would be able to still get food stamps. So I just wanted to share my story with you all because I think it's very, very interesting that this is kind of the state of child care in different places all around the nation, that someone like me, working professional, has a bachelor's degree and things like that, but because I only have a single income household, that's one of the barriers being matched again with very expensive child care cities as well.
Thank you so much, Thank you so much, Mari.
Thank you so much for letting me talk and share my story with you all, and I just want to say thank you all for being interested in this issue of child care. A lot of people don't even know that it exists and their parents struggle with it.
Well, thank you again, and we look forward to hearing. I look forward to hearing what happens to you in the future. And we all recognize that you're the type of parent we're working on behalf of, and so thank you for sharing your story.
Thank you so much. Have a great day.
You too. So, yes, if we can go back to the policy recommendations slide. So, yeah, hearing her story is really compelling. It really helps us think about the work that we do. And as a result of the work that we did, we work with the policy team to come up with some policy recommendations for this work. And some of them make total sense to you, I'm sure. We are calling for increased funding and resources to support sufficient local, state, and public investment to leverage CCR capacity and other organizations' capacity to support these new CCDBG requirements. We want to make sure that there's some funds that are authorized to support data collection by CCR and state partners. And also, we want to make sure that there are places where people can go where they can identify potential funding sources. We just found out in Vermont that the community college has received funding from the Department of Labor, and that funding will it's for education of low to middle income workers. But part of that funding includes support for child care. So really helping us think about increasing the funding, but also identifying funding that is available. We want authorized funds for piloting strategies to blend multiple funding sources. We're interested in seeing if there's opportunities to increase subsidy rates for providers who are operating in deserts. We know Ohio is doing this. We are interested in tiering subsidy rates or adding quality bonuses to reward high-quality providers who work in child care deserts. So those are some of the things that we think about in terms of the funding and resources. We also think that it's important to invest in infrastructure. So the lack of facilities impacts the inadequacy to meet the demand. And this is a huge opportunity for public and private partnerships to fill this space. For instance, we know that if there's ways that we could incentivize businesses to join in public-private investments, that would be a wonderful idea. In Georgia, there are employers who purchase or build qualified child care facilities are eligible to receive income tax credits equal to 100% of the cost of construction. So really thinking about those ideas as well. We recognize that it's, we encourage states to identify these deserts, increase infrastructure, build infrastructure, but we also need to attract workers that are qualified to provide this quality training, quality early childhood education. So we want to make sure that there is support from the federal and local level to provide training, coaching, and mentoring so that we increase retention and build the skills of these individuals who are part of our child care workforce. And we see this as another place for CCRNRs and CA providers to help build that capacity. And finally, we're interested in figuring out ways to build community capacity. Again, another place for CCRNRs to be placed in this system. Organizations like CCRNRs are doing this work, and they're doing it well. So how can we leverage their information and training and technical assistance expertise to build the supply of people who can train and provide services and TA to these centers and to these providers. We also are really interested in figuring out ways to provide resources to increase the availability of developmentally and culturally appropriate options for families. We know, for instance, that many Latino families and other families of color are interested in family child care providers and family friend and neighborhood providers. So what can we do to build the supply of quality child care providers that are serving children in the home? And finally, we want to think about ways that we can increase community-level understanding of the importance of having high-quality centers in these desert areas. We can turn the page. And then finally, we just wanted to make sure that we thank our funders. The Richard W. Goldman Foundation supported this work, the focus groups and the interviews with state-level leaders. We are very grateful to the parents who participated in our focus groups. We're extremely grateful to the representatives of the 7 communities that we featured. In the report, you'll see that there's contact information, and all of them were willing to share their experiences. And finally, we're very grateful for the coworkers and the partners who served as reviewers. I'm looking at the time, and we have run out. I know that there are lots of questions. Feel free to email me or our policy team or research team. I'm at Dionne, D-I-O-N-N-E, Dobbins, D-O-B-B-I-N-S, at usa.childcareaware.org. We'll be sending out a follow-up email to you all who participated. The presentation has been recorded, and we will be able to share that online afterwards, so look for that. And we really appreciate your time and interest in this presentation, and look forward to continuing this work in Child Care Desert. Thank you.